now. And I'm going to toss it over to you, Lisa. And you talked about a lot of different efforts, a lot of different activities going on over there. Give us your top 2 or 3 priorities for this year that you all are working on.
Well, thank you for the question, Luke. Of course, our priority continues to be interoperability and patient empowerment. I also want to note, though, that we are working diligently on the administration's priorities. COVID response and recovery, of course, continues to be a priority for us. I want to give my condolences to anyone who has lost loved ones during this pandemic and or has been adversely affected in any way with your own health. You have my condolences, and thank you to all of our healthcare workers who have been working for over a year diligently, and all of the first-line essential workers as well. As far as our work in regard to COVID response and recovery, we are, as you know, responsible for making sure information flows, and we have recognized that we need to do more in regard to ensuring information is flowing from the public health agencies to clinicians and from clinicians to public health agencies. So that cycle is going to be an area of focus for us, making sure that that data moves and that everyone has what they need at the point of care, especially to ensure that if another pandemic occurs, and some people say that it's not if, but when, that we are better positioned from an information sharing perspective. We also are working on equity. And my boss, our national coordinator, Dr. Mickey Trapassi, talks about equity by design. And so we really are looking to ensure equity in every aspect of the policies and programs that we influence and that we implement. We are looking at equity not just from the perspective of the healthcare system itself, but still for all of the trillions of dollars that we put into healthcare, the biggest determinant of someone's health and life expectancy is still their zip code. So we have to look at social determinants of health. So we are looking at that as an area of focus as well. And we continue to just push forward for standards-based approaches to health information technology in every area.
So